doctor's going to prescribe medications for you. Now, we've all heard of insulin, and for a type 1 diabetic, that's what's going to keep them alive. But aside from insulin, for type 2 diabetes, there are now 11 classes of medication for use to treat the disease. Many are grossly expensive, and in 2022, a very respected medical journal published a supplemental edition in cooperation with the American College of Lifestyle Medicine. And this is a must-read for every family doctor if that doctor wants to really help his or her patients to recover better from all chronic and autoimmune disease. When I was going through the section on type 2 diabetes, I was blown away. I read that according to a meta-analysis, now meta-analysis means an examination of existing data, and they looked at 13 previous randomized controlled studies. All of this intensive glucose-lowering treatment showed no benefit on all-cause mortality, and there was actually a 43% increase in death from cardiovascular events. You heard me right. No great benefit on all-cause early mortality and a 43% increase in death from cardiovascular events. Now, nobody explains this whole disease better than Dr. Neil Barnard from the Physicians Committee of Responsible Medicine. And here's what he said, and I'm quoting, "Insulin is a hormone secreted from the pancreas in response to rising blood sugars after we eat," and that's a normal thing. Our blood sugar goes up after we eat. Insulin then acts as a key to unlock the cells so that glucose can move from the blood into the cells where it can be used to produce energy. Most of the glucose gets taken up by the muscle and liver cells. Too much fat stored in our muscle and liver cells, as well as elevated free fatty acids in the blood, and the resultant inflammation prevent these cells from functioning normally. I know this is a lot of stuff, but just pay attention for another minute. For example, we have too much fat inside the muscle cells. They're less responsive to insulin and become what we call insulin resistant, which means they take up less glucose, leading to higher levels of glucose in the blood. This can be due to consuming too many calories in total, and certainly too many calories of saturated fat. Not sugar, saturated fat. Even without medication, this can be a reversible situation for most people, and even curable, I don't care what the Mayo Clinic says, even curable for some.